Welcome everyone to our weekly Q&A with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Of course, thanks for having me.
My pleasure. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. If you haven't joined us before, because we're fairly new on YouTube, the way it goes is we've been collecting your questions for the doctor over the past 4 or 5 days, and we'll be presenting them to her today live. She's never seen them before. It's all off the cuff. If you haven't had a chance to submit your questions, you can still do so in the live chat in this broadcast, and we will try to get to as many questions as we can within this short 30-minute period that we have with the doctor. I will ask you to excuse me today. My throat is a little itchy, but other than that, we are good to go. Doctor, are you ready?
Yeah, let's go.
Okay, wonderful. So let's get started with our submitted questions. We usually start with vaccine questions, and then we move on to other questions because vaccines are still top of mind for most people. So let's start with Tracy's question. Tracy says, now that the province has opened up a bit more, how do we navigate this newfound freedom with unvaccinated family members like children? How do we keep them safe and still live a little bit?
Okay, so good question. I mean, I think the best way to protect children or to interact with children is to ensure that all the adults and those who are 12 plus around them are vaccinated. That is something that we can control. So that's the first thing that I would say. And then I would say, you know, especially if you're in an indoor setting with children, consider wearing masks. You know, especially if it's a crowded place, absolutely would recommend that. Try and keep the gatherings outdoors. We know that that will reduce the risk. You may also want to consider telling people if you're not feeling well, if you have a symptom, please don't come, because that will at least help to prevent anyone who has symptoms from spreading COVID as well.
Right, absolutely. And then let's go to Graham's question. Graham asks, my question is about the interaction of people who are unvaccinated. I know that people that are vaccinated are protected, however, they can still carry the virus. So does that not create a false sense of security as we open up venues to vaccinated people? If a vaccinated person attends a concert or event and is carrying the disease, doesn't that just open up the door to broader infections even among vaccinated people?
Okay, so vaccinated people can still get COVID, yes. And in that sense, they can still transmit the disease. It's not clear that vaccinated people can carry COVID, like that they're more likely to be asymptomatic and spread it broadly. That part is not actually very clear. It is clear if someone gets COVID, even has symptoms like a mild runny nose, vaccinated or unvaccinated, that you could still transmit in that way. So, but we do know, like our data from the City of Toronto shows that 84% of people who have gotten COVID in the last few weeks have been unvaccinated people. And so we know that it still reduces the risk quite a bit by just dealing with vaccinated individuals. That being said, as this person has asked, the risk does not go down to zero. And so especially in a crowded indoor place, wear that mask, keep that physical distance to, again, continue to reduce that risk.
Right, okay. And then let's go on to Guy's question. Will natural immunity be considered for a medical exemption from the vaccine?
So natural immunity is considered if you got COVID within the last 90 days. So for some policies that is taken into account, but if you had COVID more than that, then your immunity from your COVID is not considered to last, right, and you would be considered non-immune.
Right. So then there's actually a related question to that, and perhaps we can go a little deeper into it. Previously Positive asks, how will previously positive individuals be considered if they show a high antibody testing rate? Natural immunity from past infection is real and can vary per person, but the total spike protein antibody test can give a reading on the antibodies. So there should be a consideration here, is what they're saying.
Yeah, I think scientifically that has not been landed. Like, I think they're absolutely right. There can be quite a lot of variability between how much antibody response or immune response you get following vaccination, but it's not clear how well that will protect you 6 months, 1 year later. And I think just relying on the antibody test, we have talked about this before, that the immunity is more than just about antibodies. Even if the antibodies are there, it's really hard to correlate them with protection to say if your antibody level is this, it means that you will be protected for this amount of time. And so that's why right now it's really just time-based, 90 days from your last infection. And beyond that, you really can't guarantee your protection.
Right. Okay, and let's go to the next question here. Tanya asks, I don't know if I'm going to pronounce this right, so bear with me. She says, can someone with dermatographism get the COVID-19 vaccine?
So most people with most conditions, including skin conditions, it sounds like this might be one, or an autoimmune condition, can safely get vaccinated and are actually recommended to safely be vaccinated.
Okay, perfect. And then RT says, is it really going to be safe for children, especially under 11 and not vaccinated, to go to school? How many children in Ontario are hospitalized with COVID?
Okay, so there's no question that we're going to see COVID cases in children, especially 11 and under, because they are unvaccinated. And so what we have to rely on when we go to school is, first of all the people around them who can be vaccinated are vaccinated. That is so important. But also that we have all of those other measures in place, like wearing masks, including in kindergarten, having the teachers wear masks, keeping that physical distance, watching when you take your mask off to have lunch, that there are controls in place. And that's going to help to allow even children who can't be vaccinated to attend school in person. Right.
And actually, since we're talking about school, there's a live question coming in here from our website. Tariq asks, can I get kicked out of school if I don't get the jab in high school or middle school?
So we're expecting that there will be policies in place for vaccinations of students. Right now, what we have in the Immunization School People's Act, you're either required to be vaccinated or have a valid exemption. And a valid exemption could include watching an education video and having a form signed, for example. Right. What it does mean, though, is that if someone in your cohort at school, one of your classrooms, someone is there, they're contagious with COVID when you are there, you will be excluded and you will have to stay home for 10 days. But if you're vaccinated, you will still be able to attend school.
Okay. Okay, let's take another live question here from our website. Diana asks, it's not vaccine related, but we'll take it anyway. Is winter expected to make wave 4 even worse?
Well, we know that in the winter, the late fall, that we move indoors and actually we give a very good grounds for all kinds of viruses to start spreading. Yeah. And the COVID virus will be the same in the winter. And it's mostly because we're indoors, the ventilation is not as good, we're coughing and sneezing on places, touching surfaces, and we're crowded together. We can't keep that distance as well. So we know that yes, we can expect that COVID will spread more in the winter.
Right. Okay, let's go back to these submitted questions. Wings asks, are the hospitalized fully vaccinated patients in the ICU or on ventilators? When did these patients receive their second dose? These numbers are alarming and may discourage vaccinations.
Okay, so data that I have from Toronto from just a few weeks ago was that 98% of people who were admitted to hospital were unvaccinated. So they're very, very small percentage of people who are vaccinated and are either hospitalized or in ICU or have died, very small percentage. Some who have gotten hospitalized might be in the long-term care. There's an outbreak there. They're vaccinated. Again, we know in long-term care, the older you are, you may have a weakened immune system, and so could still get hospitalized, but very, very, very less likely.
Okay. Okay, Rob has a question, and just bear with me. It's a little bit long. Rob says, I was in the 60 to 64 age group who was offered and encouraged to get 2 AstraZeneca shots early on. and even before they approved mixed doses. And they say that I feel abandoned in the current data discussions and planning, as having 2 doses of AstraZeneca is just not being addressed anymore. We're only talking about mRNA and mixed vaccines. So it has been said that 2 AstraZeneca doses are not as effective in general compared to the mRNA doses or the mixed doses. Where do people like me stand when it comes to needing a booster shot or being eligible for a booster shot because the vaccine that I took was less effective in the first place?
Okay, so I think it's important to know that 2 doses of AstraZeneca do still give you that good protection against the hospitalizations and deaths. So I think that that's important to know. The data is constantly being looked at to say, you know, does someone who had 2 AstraZeneca vaccines need a booster dose? What if you had 1 Johnson & Johnson, you came from the US, do you need a booster dose? So that's ongoing. No, you're not abandoned. And certainly if there's evidence that, you know, you're less protected, there may be guidance for a booster dose in the future. And so that is actually being looked at for sure. If I could just go back to the earlier question about those who are hospitalized and in the ICU, it's the fully vaccinated. That percentage of 98% is people who were not fully vaccinated. So certainly there are some who have had maybe 1 dose, or have not waited those 2 weeks that, puts you at higher risk for those hospitalizations. It's really 2 doses, 2 weeks after the last dose that you really get that best protection.
Right, absolutely, right. Okay, and then, sorry, and when it comes to the AstraZeneca question that we were talking about, you mentioned that they're still actively looking into whether or not people who have gotten both shots of AstraZeneca need a 3rd booster dose. That hasn't been conclusively determined yet.
Yeah, all of these things about who do we need to expand booster doses for more people. I mean, we've been talking about this actually since January, that right now there's no need, but if the data shows that there's a need for booster doses in particular populations, which has happened in Ontario, right? If you have an organ transplant or you're in a resident of long-term care, it's recommended. Right. But that will be looked at for other groups as well too. It will be looked at on a national level and also provincially as well.
Right, absolutely. Okay. And then MK asks, and I'm not sure if this guidance has come out yet, but MK asks, will airport screening officers get the order for a mandatory vaccine as they come in close contact with the general public all the time?
Yeah, it's a very good question. I mean, I only know what you know through the media. I haven't seen the policy from the federal government for who is considered a federal employee and will be required to be vaccinated. We're certainly seeing, though, businesses, many businesses, many big businesses and small businesses that are making vaccine mandates for their staff as well.
Mm-hmm, absolutely. And I think that's the main thing, is that on the one hand, it can be mandated by the government for certain professions, but private businesses can pretty much do whatever they want and put these policies in place, right?
Yeah, and not even just private businesses. Like, I can speak for, I work at the City of Toronto, and the City of Toronto has come out with a policy. That's a municipal government as well, too.
Yes, absolutely. Okay, and then let's move on to Anna's question. How could a city that is so vaccinated, like in terms of percentage, we've got so many people vaccinated, how are we undergoing a surge? Does the vaccine not work as advertised?
Well, in Toronto, we have 82% who are 12 years and older who have had 1 dose, and about 75% have had 2 doses. So if you think about that, there's still 1 in 4 people who could be vaccinated who are not. And so, if you do the math, right, in a population of millions, that's still an awful lot of people who are not protected at all and can get COVID and can spread it.
Right. And now that we're opening up a little bit more, there is more contact between people. And so that's, if people are not vaccinated, that's going to happen.
And we have the Delta variant, and the Delta variant, it spreads that much more easily. And so with the Delta variant, you need way more than 75% to be able to really, have the vaccinations work on a real population level.
Right. And then let's go on to another one here. Susan asks, would you consider it safer for air and train passengers to be fully vaccinated, or every passenger tested negative before their departure, and why?
I would say that being fully vaccinated will give you better protection than testing. I mean, last year we had testing was our only option, and we actually saw people use testing on the weekend or something if they were making plans, and it didn't actually work out. You could test negative and still be contagious or incubating and spread the virus. So there's no question that being fully vaccinated will be the better policy option.
Right, right. Yeah, and that makes sense because we've talked about this so often. Your negative test is only good for the day of that test. Beyond that, you could get it, you could be incubating and you don't know.
That's right. Yeah, that's right. It also depends on the type of test, right? Like we have these rapid antigen tests. Those are screening tests. They're quite convenient, but they're actually not the best test. And so we know that there can be sometimes false positive or false negatives with those tests as well.
Yeah, absolutely. And let's do a live question. mRNA single-dose Johnson & Johnson vaccine be available in Canada?
Yeah, I'm not sure when it will be available. Again, it depends on the manufacturer, whether they're able to produce enough to be able to send it to different countries. And so I don't have any sense of when we may in Canada be getting it. I can certainly say, though, we have plenty of Pfizer and Moderna, and those are really excellent vaccines.
Right, right. And then let's take another live question here from YouTube. Tony asks, has ivermectin been effective in India, and should it be studied as a COVID treatment here?
Ivermectin has been studied and it's found not to be effective for COVID. I mean, ivermectin is a good drug to treat severe scabies, severe lice, like, other kind of bugs, but it's really has not been proven to be effective against the COVID virus.
Right, right. Okay. Because we get that question a lot about ivermectin, and I personally never heard of it before COVID came along. And so I'm sure if it was effective as a drug, we would know about it by now, right?
That's right. If the studies show that it worked, we would certainly use it. Yeah.
Okay. Peter asks, if I get the COVID vaccine, can I still pass on COVID-19 and its variants?
You're much, much less likely to do that. I mean, we know that if you're vaccinated, if you're unvaccinated, you're 8 times more likely to get COVID and to spread it. And if you're unvaccinated, you're much less likely to catch COVID and to spread it.
Okay. And then Lena asks, how can I avoid any adverse side effects from the vaccines?
Well, it's really hard to predict who has side effects. Some people are so worried about their side effects and then they have none. Others do have a fever, they might be in bed for a day, and others really just a sore arm. And the side effects can be different between your first dose and your second dose. Usually it's more, you get a stronger side effects after the second dose, but that's not the case for everyone either. So what I would say, get vaccinated. If you're off on the weekends, try and get vaccinated on a Friday, say, if you're really nervous about it. But if you have symptoms, like you have a fever, you're not feeling well, you can certainly take over-the-counter medications to treat some of your symptoms.
Right. Okay. And then that's about it for the vaccine questions. We have a few more minutes left, so I'm going to try and grab some non-vaccine related questions. Excuse me. So we've got a lot of school related questions because kids are heading back to school now. And we've got about 4 people, Anne, Diana, Jennifer, and Anonymous, who are all asking, is it safe to send my kids back to school in September? What are the extra measures that are being taken in schools this year as compared to last year? Is it actually safer now to go back to school than it was back then?
Okay, so I think there's a couple of things that we need to consider for why I would certainly recommend that kids return to in-person learning, like going back to school. One is we have vaccines now, and even if your child, 7-year-old, can't be vaccinated, the people around them, their household hopefully is vaccinated. We're trying to get our vaccination rates up as high as possible. And there will be measures in place for staff to be vaccinated or have a policy as well. We will continue to recommend masking and distancing and cohorting. So all of those measures that we had last year will continue to be in place. The numbers, while they're going up, are still manageable. They're still low compared to where we were at the height of our 3rd wave. They're certainly not that high. So that's another point to consider as well. As well as public health will be doing case and contact management for every cases. We're going to work with the principals and the schools to prevent any spread in the school setting as well. I think probably some of the bigger risks that we're seeing for children is they're getting COVID from a household member, from someone who has COVID in the house. And so as much as we can prevent the spread of COVID out of school, that will help to keep schools safer as well.
Right. I think the biggest thing, Doctor, that you mentioned is that we have the vaccine now. So there's going to be that many more kids. Of course, kids under 12 can't be vaccinated, but the rest of the population in school will be vaccinated ideally. And so that's the biggest difference, I guess, from last fall and this fall.
That is absolutely one of our best measures this year. Absolutely.
Right. Okay. And then let's move on. Okay, this is also school related. Shan asks, I signed up both my kids ages 5 and 10 for in-class learning. Both are of course not vaccinated because they're not eligible yet. Recent COVID-19 cases are increasing day by day. What are the chances that in-class will switch to online anytime soon? Do we expect that to happen midway through the year?
So the Ontario Science Table and hospital partners put out some recommendations regarding schools, including what measures to have in schools, and talked about schools should only be closed if there is a catastrophe. Okay. And so really the goal is to keep schools open for students because there is a lot for students to gain. And so really what we need to look at is what in our community do we need to maybe what kind of measures need to be in place there in order to allow kids to attend school, and that they really only want to switch to online learning as a last resort.
Right, okay. And then we've got a couple of questions regarding going out and eating because now restaurants are finally open. Ali asks, does COVID spread through food? Can a person who's prepping food pass on COVID to the consumer? And is it safe to eat takeout without reheating or recooking it?
Yeah, we haven't had this question in a while. Actually, there is no new evidence that COVID is spread through food. And so it's not the food itself that you really have to worry about. It's if you're in a restaurant with 3 other people you don't live with, that's how COVID would spread in a food setting, but not through the food itself.
Right. And the same goes for when you get takeout, whether it's reheating or recooking. It's not the food so much, but possibly the containers or the person that you took it from in close quarters, that kind of thing, right?
Yeah, the containers would be less likely. Again, yeah, making sure that you're masked when you pick up your food, wash your hands as you pick up the food. Again, the restaurants have to follow the food safety guidelines that are in place, and those will help to prevent any contamination or spread of COVID inside the food.
Right. Okay. And then this is one from Twitter, so I'll read their Twitter handle. Showtime818 says, are current COVID testing measures being used to diagnose the public able to differentiate between COVID-19 and the common cold or seasonal flu? Is there a possibility that people are receiving false positives from these tests?
It's really hard to tell clinically, whether it's one or the other. I mean, there are a few telltale. If you've lost your sense of taste or smell, that is pretty much always COVID. There's really no other virus that does that, for example. So that's why we need the testing. Now, there's no evidence that if you have one of these other viruses that you're more likely to test positive for COVID and it be a false positive. I think it's more the type of test. Some tests are better tests than others. And so we know that the best test still is that deep nasal, that nasopharyngeal swab that's sent for PCR testing in the lab. That is still the better test compared to the rapid antigen test, which we had talked about earlier, for example.
Right. Okay. And then this was a question that came up sort of early on in the pandemic, but let's talk about it again. Again, this person's handle on Twitter is CTPN8piece. They ask, why is wastewater not being analyzed and reported on? This would be a good metric of COVID numbers prior to the fall and the fourth wave. We know that things are much worse than are being reported.
Yeah, so good question about wastewater. I mean, it is being reported in some places. I certainly see some of the reports for some of that internally in the city, but it's just quite not ready yet to be able to be posted publicly. So, but there is surveillance on wastewater,
right?
And to kind of, you have to be sure that you're. Which wastewater do you test? Is it a representative sample of that neighborhood or community? How often do you test it? So some of these things are still being worked out as well.
Right, absolutely. And then I'll squeeze in just one last question here. SMC asks, is domestic air travel risky with kids now that the Delta variant is here?
So when you travel, I mean, there are precautions that are in place, and so when kids can't be vaccinated, there's that masking and distancing. Of course, you can't distance on a plane, and so that's where it will be important to make sure there's screening done as well. I think that, traveling in a plane, is that different from if you're traveling in a car with people you don't live with? Well, that may actually be a higher risk setting if you're traveling for hours and hours and hours. And staying somewhere indoors with them. So I think it's all about evaluating each individual risk. There is no zero risk. And so everything we do has risk, and that's why we have to have measures in place to prevent as much of the risk as possible.
Right, absolutely. And so that brings us to 1 o'clock. Thank you to everybody that submitted your questions over the past week and live as well. Thank you, Doctor, for taking the time and being patient with all of these questions for us. If you didn't have a chance to get your question answered, we will have the doctor back with us next week. So we'll try and get to it next week. For now, we'll sign off. Thank you so much, Doctor.
Bye.